Okay, so the first thing I want to talk about now is the relationship between hyperbaric oxygen therapy and let's call it hard to heal ulcers. Now, as you can understand, hard to heal ulcers are quite problematic in some ways. Let's start with the idea that they may be infected. Now, how hyperbaric oxygen therapy is related to infection. And the idea is that hyperbaric oxygen is quite problematic to anaerobic bacteria because they need to develop and live in an anaerobic area in order to survive. This is quite straightaway for anaerobic bacteria. So this is quite understandable. But what about aerobic bacteria? If we have an infection, there are aerobic bacteria. What about hyperbaric oxygen therapy? Does it help the bacteria live or does it help us kill the bacteria? Now, it's a little bit more complicated because until certain threshold of oxygen pressure, the aerobic bacteria will strive, will proliferate, will live. And this threshold is somewhere around 1.3 atmospheres of hyperbaric oxygen. This is or below that, when we give oxygen, the aerobic bacteria will live. But above that threshold, and especially above 2 atmosphere pressure of hyperbaric oxygen therapy, the hyperbaric oxygen therapy caused too much damage, too much reactive oxygen species that it damages. Even aerobic bacteria are damaged for such high pressure of oxygen. So above pressure of oxygen of 2 atmosphere, of course, there are some that say even above 1.3 atmosphere is dangerous and detrimental and bad for even aerobic bacteria. So this is why hyperbaric oxygen therapy can even help fight aerobic infections and not just anaerobic infections. Now, there is another thing. Remember that neutrophils, for example, our immune system um, use oxygen to fight infections. So, in an area that is hypoxic, for example, ulcers that are not healed very good, they are usually hypoxic areas. So, neutrophils there, they have hard time to use the oxygen to fight infection. They use the oxygen to create reactive oxygen species to fight bacteria, to fight infection. So when we give a probiotic oxygen therapy, we help the neutrophils create those ROS, reactive oxygen species, to fight infections. This is another important thing. You also need to remember that in too high pressures or too high pressure of baric oxygen therapy, that it can help the immune system, but above a certain threshold, around more than 2.5 atmospheres, the hyperbaric oxygen therapy even become immunosuppressive. So we want to adjust the treatment such that for ulcer and hard to treat ulcer and infections, the treatment will be somewhere around 2 to 2.5 atmospheres. And the idea is usually 2.5 atmospheres. And so we can fight infections and not cause immunosuppression, but help the immune system. So this is the relation. And now in hard to treat ulcers, we want to create fibroblasts, collagen, blood vessels. So this is another area where hyperbaric oxygen therapy helps because HBOT helps in angiogenesis by releasing VEGF, vascular arterial growth factors. So this is one way by which hyperbaric oxygen therapy helps to heal the, let's call it the flesh, the tissue of the ulcer. Another important thing is that it helps fibroblasts proliferate and collagen deposition. So it helps heal the ulcer and create the collagen we need to cure it. So when you think about all those things together, the angiogenesis, the collagen, the fibroblasts, the help for the immune system, the killing of anaerobic bacteria by inducing an aerobic area, even killing aerobic bacteria by inducing reactive oxygen therapy above what they can cope with. And even sometimes help with some antibiotics to be more effective. All those things together can be thought as the way by which hyperbaric oxygen therapy can contribute to how to treat ulcers and chronic ulcers, like you think about in diabetes, that they have hard time because they have vascular problems, vasculopathies, diabetic vasculopathies. Um, so they may have ulcers, especially with the neuropathy, that they don't feel pain, so they create ulcers. So you may think of hyperbaric oxygen therapy as an adjusting therapy. So of course, it's not the main therapy, but it may be as an adjunctive therapy. This is the relationship I wanted to talk about between hyperbaric oxygen therapy and all the things we talk together under the umbrella of how to treat ulcers and infections and the relation to HBOT. Thank you very much. I think that that's it for now. But if you want, let's see the HBOT mechanism in treating hard to treat ulcers. Just to see a little bit, I won't go throughout it all, but enhanced tissue oxygenation and dramatically increased oxygen and collagen synthesis, fibroblast proliferation, and epithelialization. We talked about it. Angiogenesis as the relationship between HBOT and VEGF. We talked about it. Reduction in inflammation and edema. This is because HBOT causes reduction of inflammation by vasoconstriction. We can see that reduced local adhesion and cause vasoconstriction without compromised oxygen because we give a high concentration. Antimicrobial effect, especially anaerobes, as we talked, oxidative killing of neutrophils. Okay, this is I didn't know, but okay. Stem cell mobilization and growth factor. I didn't really know about it, but okay. Living tissue epoxy, HBOT can reduce ischemic pain, often associated with chronic ulcers. Okay, diabetic foot, we talked about it. Where there are leg ulcers, support healing with poor circulation, epoxy are major barriers. We talked about the VEGF and angiogenesis. HBOT works by flooding epoxic ulcer tissue with oxygen that just started healing process, fighting infection, and stimulating new vessel growth. Okay, this is just for you to see it written down by, but we talked on the main things about it. So this is the relationship between hyperbaric oxygen therapy a little bit and how to treat ulcers, chronic ulcer, diabetic ulcers, venous or arterial ulcers, and the mechanism related to the treatment. And maybe we need to talk about protocol treatment of HBOT for this. And you will see the protocols. You see 2 to 2.5. We talked about this range that is important, and especially 2.5 is very known for this. Sometimes 2. Remember the oxygen toxicity, you need to talk about it. And frequency 5 to 7 days per week, and usually 20 to 40 sessions, up to 60 sessions is really slow. Diabetic ulcer, ventricular ulcers, arterial ischemic ulcer, or pressure ulcers, those are the main things. We need to think about oxygen and bowel trauma and everything we need to know and think in any hyperbaric oxygen therapy. Bowel trauma and oxygen toxicity is not related just to this, so remember this. And if no improvement in 20 to 30 sessions is usually not justified to continue, so this is our limit. And I think this is it for now. Okay, so this was a little bit about the relationship between ulcers and hyperbaric oxygen therapy. Thank you very much all. If there are any mistakes or corrections, please write in the comments here below. And that's it for now. Thanks for Copilot for helping me writing things down. And thank you all, and that's it.